Hi, this is Alex Mann, and this is my exercise management PowerPoint for EHR 314. So topics discussed in today's PowerPoint will be a brief introduction to exercise management, including problem-oriented exercise management plan, SOAP notes, and formulating an exercise management plan using the SMART acronym. And then I'll go on to benefits of exercise in chronic conditions. So I'll briefly go over risk versus benefits, reduction and prevention, and biological improvements. And then from that, I'll just grab a couple of improvements with exercise, and I'll just talk about them in a little bit more depth. So firstly, POEM. POEM allows a systematic approach for complex health issues. Without this approach, a beneficial exercise management program will be difficult to achieve. POEM encompasses 5 steps. The acronym for this 5-stage approach is called SOAP notes. I won't go into too much detail about SOAP notes, but I'll just briefly go over and outline what each step is. So firstly, subjective data, which is just a comprehensive medical history review, and this is all the information given to you by the client when they come in for their referral. Objective data is all the information you collect. That's either during a physical examination and from laboratory studies. Then you'll make an assessment using both subjective and objective data to generate a list of specific problems. And then from that, you'll make a plan, and then you'll use the SMART acronym to do this, and we'll go and I'll explain the SMART acronym in the next slide. And then finally, the last step is a periodic reassessment. So this is just reassessment of client's condition. That's either progression and or regression, and you just do that periodically throughout the rehabilitation program. So what is the SMART acronym? SMART just means specific, measurable, actionable, realistic, and time. And there's some information in regards to the SMART acronym there. Okay, so what is the role of exercise in rehabilitation? The use of exercise should be to increase the quality of life for the individual who is suffering from a chronic disease or diseases. The main goals outlined are as follows: mediate the effects of a particular condition limiting functional ability, increase overall functional capacity and strength, increase lifestyle physical activity and daily energy expenditure, enhance metabolism of carbohydrates and lipids, and finally promote normalization of cardiovascular function. So what are the risks versus benefits of exercise? When implementing an exercise management plan for chronic condition patients, there are some common risks associated with exercise delivery. These are 1. Musculoskeletal injury, 2. Heart attack, and 3. Sudden death. Exercise involves 2 types of risks: disease-dependent and activity-dependent. Disease-dependent risks refer to risks which may arise from the condition rather than participating in exercise. Activity-dependent risks are those associated with risks that are involved in exercise. Example, improper use of machine weights may result in a muscle strain. When training clients with chronic conditions, disease-dependent risks are our main focus. Example, a diabetic losing control of blood sugar levels would be very detrimental to a rehabilitation program. And finally, during the developmental phase of a training plan, an in-depth knowledge of all potential risks associated with the chronic condition and all possible prevention measures should be known. Okay, so the reduction and prevention. Exercise is a useful tool for the reduction and prevention of many chronic diseases. Below are just some common diseases which exercise help reduce the effect in diagnosed patients and prevent in undiagnosed patients. These are stroke, metabolic syndrome, type 2 diabetes, mental health, depression, certain types of cancer, arthritis, falls prevention or falls rehabilitation also, and CVD. Okay, so what are the biological improvements with exercise? A study in 2009 outlined many benefits which come from exercise, and these are as follows: improved body composition, improved lipid lipoprotein profiles, improved glucose homeostasis and insulin sensitivity, reduced blood pressure, improved autonomic tone, enhanced immune system function, reduced systemic inflammation, decreased blood coagulation, improved coronary blood flow, augmented cardiac feedback, cardiac function, 11, enhanced endothelial function, 12, improved psychological well-being, so this is reduced stress, depression, and anxiety, 13, maintenance of bone mineral density, and finally, it improves pulmonary function. So from this list here, I'm just going to grab a couple of the main ones, which help many chronic conditions, and I'll just go into a bit more detail in regards to them now. So the first one is improved cognitive function. This is beneficial for anyone with a chronic condition, as there's the added stress levels and anxiety levels that come along with the condition, and also many people who suffer from depression will benefit from this. So there was a longitudinal study conducted by Pinedo and Dan in 2005, which suggests that exercise and physical activity improves the well-being of clients across several physical and mental health outcomes. Exercise and physical activity have shown better health outcomes, including a greater quality of life as functional capacity and mood states improve. Centers for Disease Control and Prevention in 2015 stated that simply participating in aerobic and muscular strengthening activities 3 to 5 times a week for 30 to 60 minutes can improve learning, judgment skills, and decrease the risk of depression and improve and promote sleeping patterns. Secondly, improve good cholesterol. So this is specifically important for people who suffer from type 2 diabetes. Coronary heart disease has been associated with low plasma HDL cholesterol levels. In 2001, there was a research which explored the relationship between endurance exercise training and the effect it has on plasma HDL levels. Research found that endurance exercise increased HDL levels. This shown to reduce the risk of coronary heart disease even if there has not been any change in LDL cholesterol levels. There have been previous studies also which have suggested that exercise has a HDL raising effect, which has been also connected to a loss of body fat mass. An increase in HDL cholesterol levels due to exercise proves useful for high-risk overweight dyslipidemia patients with insulin resistance, hyperinsulinemia, and hypertriglyceridemia, and finally low HDL levels. As the net increase in energy expenditure produced from regular exercise may induce mobilization of body fat and weight loss, thus improving insulin action, lower TG levels, and increased plasma HDL cholesterol concentrations. And over here on the right hand side, I put a table in from the following people. In 2001 the study was conducted, and you can see the percentage change from baseline here, and these are your HDL level values up here, and you can see that across the board there's been an increase. And the same down here, this is predominantly your LDLs, and percentage change from baseline, and you can see that there's been a decrease in your LDL levels and your TG levels. Going on to how exercise helps reduce blood pressure. So this is important for people who suffer from hypertension or even any other CVD condition. A study conducted by the following people in 2005 explored the relationship between endurance training and the effect on blood pressure, specifically regulating mechanisms and cardiovascular function. Research found that endurance-based training has the following benefits on blood pressure. Training lowers blood pressure, showing hypertensive patients had the greatest decrease compared to non-hypertensive individuals. Secondly, blood pressure reduction was due to a decrease in SVR, systemic vascular resistance, with further evidence showing that a sympathetic nervous system and the renin-angiotensin system played a role in this reduction. And third and lastly, endurance-based exercise has beneficial effects on other cardiovascular risk factors. Research conducted in 2001 tested to identify the change in blood pressure over a 4-week period. Results shown that on average non-hypertensive patients had a decrease in their blood pressure by 2 to 3 millimeters of mercury. However, there was a more dramatic effect over the 4 weeks, with hypertensive patients having an average reduction of 6 to 7 millimeters of mercury. This information can be seen on the table presented on the right hand side. So over here you can see the black dots represent hypertensive patients. This zero line here shows the baseline, and this shows the decrease in their systolic blood pressure. So you can see that overall most hypertensive patients had a decrease, and these could be two outliers due to white collar syndrome, or might be the anxiety or stress levels that day which could have just raised them up. But as you can see, the majority of clients had a decrease ranging from almost -5 to past -15. And the same goes down here for the change in diastolic. You can see that the majority of hypertensive patients had a decrease ranging from -1 to approximately -10 to 11, except there was one outlier, but as you can see, the majority of people had a decrease due to the exercise over the 4-week period. Going on to maintenance of bone mineral density. It has been shown that a decrease in physical activity is directly related to incremental loss of bone mineral density and increase in the incidence of osteoporotic fractures. A study conducted in 1989 found a direct correlation between weight-bearing activities and improvements in bone mineral density at specific weight-bearing locations in the body. These locations were the lumbar spine, trochanter, and femoral neck. A study in 2006 supported the 1989 study, identifying that over a 3-year period consisting of low volume, high intensity exercise proved a maintenance in bone mineral density at the spine, hip, and calcaneus of postmenopausal women. This has proved useful information, as it has been known that postmenopausal women, due to hormonal changes in the body, have a greater susceptibility to losing bone mass, increasing the chances of osteoporosis and fractures. So you can see over here this table, it shows bone mineral density of the lumbar spine, and you can see that through exercise there's been a decreased amount of bone mineral loss compared to the control group, and even in some cases an increase. And the same goes here for the proximal femur. There's been a better maintenance of bone mineral density in exercise patients, and even a slight increase. And you can see down here this is the duration in months. So this information is specifically important for elderly clients who may suffer from osteoporosis and have had recurring falls and are at risk of bone fractures. So finally, going on to pulmonary rehabilitation and exercise. Exercise has been shown to be beneficial for patients with chronic obstructive pulmonary disease. The following people in 2013 prescribed that various types of physical training help improve patients with a pulmonary disorder or disease. It was stated that implementation of outdoor Nordic walking exercise programs significantly improved the exercise capacity and physical activity of patients. These gains were sustained for 6 to 9 months after the initial intervention. Interval training has shown to be effective exercise, and even in patients with severe COPD, with comparable improvements in exercise capacity, health-related quality of life, and skeletal muscle adaptations immediately after training. Resistance training is also useful in rehabilitation of patients with a chronic respiratory disease. Resistance training has been linked to greater increase in muscle mass and strength, which results in decrease in induced dyspnea. A further study in 2005 explored the best exercise protocol for pulmonary rehabilitation for individuals with COPD. From their findings, they outlined 3 principles, which included the following. 1. Strength exercise shown to have the largest improvements in HRQL, health-related quality of life, compared to an endurance exercise. Interval exercise may be an alternative to continuous exercise. However, evidence does not favour one or the other exercise modality. And third and lastly, there is a lack of evidence to justify if high-intensity exercise is superior to low-intensity exercise in COPD management. So the combination of resistance and endurance training is useful for treating peripheral muscle dysfunction in patients with chronic respiratory disease. So finally, just to recap all the information presented in the PowerPoint. So why should we exercise, and why should we use exercise in the management of chronic conditions? Exercise helps in the prevention of many risk factors. Exercise reduces the effect and reduces risk, like the chance of obtaining a chronic condition. Exercise helps improve the biological function, which in return increases quality of life. It improves your mental state, increases daily energy expenditure, and improves functional capabilities. So from this PowerPoint, it's easy to understand that exercise is very important in a clinical role, managing chronic conditions, and there should be a push more so to use it in regards to medications and the relationship between that and chronic conditions, as exercise is relatively safe for many chronic conditions, and it has shown to have enormous effects on the reduction and prevention of these conditions. Alright, so that is my PowerPoint. Thank you for listening.